Let anyone who either experienced or knows somebody who experienced an overdose tell you. It's a scary and, in many cases, life-changing experience. But there's a danger locally and nationally that isn't exactly new, but is becoming more prevalent. What is fentanyl?
Fentanyl is an opioid, and it's something that is safely prescribed by doctors, and it is something that's very important in the medical field.
But there's a problem. This drug is being recreated and cheaply in other countries. China and Mexico are among the main sources of trafficking of this narcotic into the United States, according to Stefan.
What we see in terms of street opioids is synthetic fentanyl. So they're taking the chemical makeup and recreating that and altering it to create these really bad analogs that we see too. And so it's something that is very much polluting our street drug supply.
Stefan explains that it is 50 to 100 times more powerful than morphine, which is found primarily in heroin. She adds that even those with an opioid tolerance could be at risk, and even overdose, and those numbers have steadily increased over the last 4 years.
That really hit its peak in 2020, where we saw about 296 overdoses, opioid overdoses, fatalities in Lucas County.
And once someone ODs, that's where the Toledo Fire and Rescue Department comes in.
We're averaging right now in the neighborhood of 100 to 120 overdoses a month within the city alone.
And Ray says there's a trend the department is noticing.
These are some of the same people that we see over and over.
And it's frustrating. He says while the issue doesn't discriminate, there are pockets of heavily impacted neighborhoods.
We track things by zip code, and we may see a rise in the 43612 area. But then the next time a data point is pulled, it might be in the 05 area or the 04 or the 13.
And because the department's made up of professionals who are trained to respond to these overdoses, prevention truly comes from naloxone distribution. Naloxone, also known by its brand name, Narcan, being something the Toledo-Lucas County Health Department has made very accessible to the community.
While fentanyl isn't in everything, it can be in anything.
Which is why, in addition to Narcan trainings,
last year we distributed well over 10,000 kits into the community and trained, over 7,000 individuals on how to use naloxone and respond to an opioid overdose.
The health department also hosts one of about 22 syringe service programs in the state of Ohio. While these programs are typically syringe for syringe, the health department's isn't. Stefan explains that's for accessibility purposes.
We kind of make adjustments based on what each individual's needs are.
And she acknowledges that there are disparities, especially in Lucas County's Black community, a gap that the department continues to assess and work to narrow. Despite the challenges that come with addressing this complicated issue, there's hope. In 2021, Lucas County experienced a 7% decrease in overdoses, and that can be attributed to many things, like us being past the onset of the pandemic. But that's as local health officials, law enforcement, and fire departments across the country are coming together to address this, at times, deadly epidemic. Reporting in Toledo, I'm Jaden Jefferson.